Looking for a revolutionary epilepsy medication? In this video, we'll delve into the key benefits and debunk the myths surrounding this game-changing drug. Whether you're searching for a more effective treatment option or simply curious about the latest breakthroughs in epilepsy therapy, Vimpat has the potential to transform lives. With its unique mode of action, Vimpat offers a fresh approach to managing seizures. Its active ingredient, lacosamide, works by targeting and stabilizing specific channels in the brain, reducing the likelihood of abnormal electrical activity that triggers seizures. This innovative mechanism sets Vimpat apart from other antiepileptic drugs on the market, making it a promising option for those seeking better seizure control. But while Vimpat presents a new hope for epilepsy patients, misinformation and misconceptions about the medication persist. From concerns about side effects to doubts about its efficacy, we'll separate fact from fiction and shed light on the truth behind Vimpat. Discover the truth about Vimpat and uncover its immense potential in transforming the lives of those living with epilepsy. Let's explore the key benefits and dispel the myths surrounding this groundbreaking epilepsy medication. Understanding the key benefits of Vimpat. Vimpat offers a range of benefits that make it an attractive option for individuals with epilepsy. Firstly, its unique mode of action provides targeted seizure control. By specifically targeting and stabilizing channels in the brain associated with abnormal electrical activity, Vimpat helps reduce the occurrence and severity of seizures. This precision approach allows for better management of epilepsy symptoms, leading to improved quality of life for patients. Secondly, Vimpat has demonstrated efficacy in various types of seizures. Clinical studies have shown positive results in controlling both focal-onset and generalized-onset seizures, making it a versatile option for individuals with different seizure types. This broad spectrum of efficacy sets Vimpat apart from some other anti-epileptic drugs that may be limited in their effectiveness against specific seizure types. Additionally, Vimpat has a favorable safety profile. While all medications come with potential side effects, Vimpat has been well tolerated by many patients. Common side effects such as dizziness, headache, and nausea are typically mild and transient. The ability to manage seizures without significant intolerable side effects is a significant advantage for individuals seeking long-term treatment options. Exploring the myths surrounding Vimpat. Despite the numerous benefits of Vimpat, myths and misconceptions about the medication continue to circulate. One common myth is that Vimpat is addictive. However, Vimpat is not classified as an addictive substance and does not produce a high or craving. It is important to remember that Vimpat is prescribed and monitored by healthcare professionals to ensure safe and appropriate usage. Another myth surrounding Vimpat is that it is only effective in certain age groups or severity levels of epilepsy. In reality, Vimpat has been studied and shown efficacy in a wide range of patients, from pediatric to adult populations, and from milder to more severe cases of epilepsy. The effectiveness of Vimpat is not limited by age or severity, making it a viable option for many individuals living with epilepsy. It is also important to address the misconception that Vimpat is a cure for epilepsy. While Vimpat can significantly reduce the frequency and severity of seizures, it does not eliminate the underlying condition. Epilepsy is a chronic neurological disorder, and Vimpat, like other anti-epileptic drugs, primarily aims to control seizures and improve quality of life. It is essential for individuals with epilepsy to continue their medication regimen as prescribed by their healthcare provider. Debunking common misconceptions about Vimpat. Let's debunk some of the common misconceptions surrounding Vimpat to provide clarity and dispel any doubts. Vimpat is less effective than other anti-epileptic drugs. Vimpat has demonstrated efficacy in clinical trials and real-world settings. It has been shown to significantly reduce seizure frequency and improve seizure control in both focal onset and generalized onset seizures. While individual responses may vary, Vimpat is considered an effective treatment option for many individuals with epilepsy. Vimpat has severe and intolerable side effects. Like any medication, Vimpat can have side effects, but they are generally mild and well tolerated. The most commonly reported side effects include dizziness, headache, and nausea. These side effects usually resolve on their own or with dosage adjustments. Serious side effects are rare but can occur with any medication. It is important to discuss any concerns or potential side effects with your healthcare provider. Vimpat is not suitable for long-term use. Vimpat is approved for long-term use in the management of epilepsy. It has been studied for extended periods, and its safety and efficacy have been established over time. Your healthcare provider will assess the risks and benefits of long-term Vimpat use based on your individual needs and circumstances. Real-life success stories with Vimpat. To truly understand the impact of Vimpat, it is essential to hear from individuals who have experienced its benefits firsthand. Real-life success stories provide insight into how Vimpat has transformed the lives of those living with epilepsy. One such success story is Sarah, a 32-year-old woman who had been struggling with frequent focal-onset seizures for years. Despite trying various antiepileptic drugs, she continued to experience seizures that disrupted her daily life. However, after starting Vimpat, Sarah noticed a significant reduction in seizure frequency and severity. She regained control over her life and was able to pursue her career and personal goals with newfound confidence. Another success story involves Mark, a 12-year-old boy diagnosed with generalized-onset seizures. Mark's seizures were not well controlled with his previous medication. However, after switching to Vimpat, his seizures became less frequent and less intense. This improvement allowed Mark to participate in activities that were previously off-limits, such as sports and school outings. These success stories highlight the transformative power of Vimpat in the lives of individuals with epilepsy. While results may vary, the potential for improved seizure control and enhanced quality of life is evident. How Vimpat works in the treatment of epilepsy. To understand how Vimpat works, it is essential to grasp the underlying mechanisms of epilepsy. Epilepsy is characterized by abnormal electrical activity in the brain, resulting in seizures. Vimpat's active ingredient, lacosamide, works by targeting and stabilizing specific channels in the brain known as sodium channels. By stabilizing these channels, Vimpat reduces the likelihood of abnormal electrical activity and seizure initiation. It essentially helps restore the balance of electrical signals in the brain, minimizing the occurrence of seizures. This unique mode of action sets Vimpat apart from other antiepileptic drugs, making it a valuable addition to the treatment arsenal for epilepsy. Choosing Vimpat as a treatment option. When considering Vimpat as a treatment option, it is crucial to involve your healthcare provider in the decision-making process. They will assess your medical history, seizure type, and individual needs to determine if Vimpat is a suitable choice for you. Your healthcare provider will consider various factors, such as the potential benefits of Vimpat in controlling your seizures, its compatibility with any other medications you may be taking, and the presence of any underlying health conditions. Together, you can make an informed decision about incorporating Vimpat into your treatment plan. Potential side effects and precautions of using Vimpat. While Vimpat is generally well tolerated, it is important to be aware of potential side effects and take necessary precautions. Some common side effects of Vimpat include dizziness, headache, and nausea. These side effects are typically mild and transient, but if they persist or become bothersome, it is important to consult your healthcare provider. In rare cases, Vimpat can cause serious side effects such as allergic reactions or changes in mood or behavior. It is crucial to report any unusual symptoms or concerns to your healthcare provider immediately. They will be able to assess the situation and make any necessary adjustments to your medication regimen. Frequently asked questions about Vimpat. Can Vimpat be used in combination with other antiepileptic drugs? Yes, Vimpat can be used in combination with other antiepileptic drugs. Your healthcare provider will determine the most appropriate combination therapy based on your individual needs and treatment goals. Is Vimpat suitable for all types of epilepsy? Vimpat has shown efficacy in various types of seizures, including focal onset and generalized onset seizures. However, the suitability of Vimpat for your specific type of epilepsy will be determined by your healthcare provider. Can Vimpat be used during pregnancy? The use of Vimpat during pregnancy should be carefully considered and discussed with your healthcare provider. They will weigh the potential risks and benefits to both the mother and the unborn child before making a decision. Can Vimpat interact with other medications? Vimpat can interact with certain medications, including other anti-epileptic drugs and certain antibiotics. It is important to inform your healthcare provider about all the medications you are currently taking to avoid potential interactions. Conclusion: empowering individuals with epilepsy through Vimpat. In conclusion, Vimpat offers a revolutionary approach to managing epilepsy by providing targeted seizure control and improved quality of life. With its unique mode of action and proven efficacy, Vimpat has the potential to transform the lives of individuals living with epilepsy. By dispelling the myths surrounding Vimpat and highlighting its key benefits, this video has provided insight into the immense potential of this groundbreaking epilepsy medication. It is important to involve your healthcare provider in the decision-making process and discuss any concerns or questions you may have. Remember, Vimpat is just one piece of the puzzle in managing epilepsy. Open communication with your healthcare provider, adherence to your prescribed treatment plan, and a supportive network can all contribute to better seizure control and an improved quality of life. Together, we can empower individuals with epilepsy and strive for a brighter future. Thanks for watching.